So warm welcome to this webinar today about digital health platforms in Sweden, a broad topic, and we will only be able to cover a few interesting questions in this context. But I'm very happy to have this session with you today. Let's see. Just a moment. Yes. Before we start, I would like to know a little bit about you. So could you answer the poll? We just want to know where you work. It gives us an indication of your experience with digital health platforms. And we expect that some of you may work at companies providing digital health platforms, while others may just be curious researchers or working in policy. Thanks a lot. So I see that yes, many of you are working with developing digital health platforms or apps focusing on the healthcare sector. And some of you are in academia, and then we have a bunch of other people. So warm welcome, and please use the chat if you have questions or comments. They will only be directed to me, and we will try to answer them after our initial presentation. As much as we can, and we do have time to stay a few minutes afterwards, after one as well, if your question has not been addressed before that. So we have a mix of people, and that's very interesting, and please engage in the conversation through the chat. I want to introduce the research team that we constitute. I am Anna Essén at House of Innovation, and together with Johan Frishammar at Luleå and Javier at Lund, I'm conducting research about digital health platforms. And the three of us have gained this grant to study digital health platforms, and in particular, how digital health platforms can be better adjusted to the needs of the elderly in Sweden. We'll provide you with a few glimpses of our research today, but we are continuing to study these issues, so stay in touch. Today we will talk about digital health platforms, first in terms of a study where we sort of zoomed out and studied the evolution of digital health platforms in Sweden in primary care, so their entry and evolution in Sweden. And then we will zoom into the use of digital health platforms among the elderly that we have generated quite a lot of data about. Before we move on, I would like to know something else about you, and that's if you have ever used the services of a digital health platform in primary care. So sometimes these platforms are referred to as the net doctors, and we want to know if you have experience of using these kinds of services. Yes, no, well, seems to be, wow, very, very even distribution here. So half of you have used these kinds of services, you've tried them, and half of you have not. So let's see how you feel after this seminar. But that's good for us to know. Thank you very much. I want to hand over to Javier now to give you some background to the emergence of digital health platforms in Sweden. Javier, please introduce this.
Thank you very much, Anna. Thank you, everyone, for coming today. It's a great pleasure to have this conversation together. So I will give you just some thoughts or some ideas related to the healthcare challenges, which is the origins for this project that we have been working on for some years. So the main idea is that current healthcare system is facing grand challenges related to aging. So population is getting older and older. You can see in this figure that the population in Sweden has changed a lot over the last decades, and the prospects are indicating a trend that there are more people over 65, and actually people are living longer. So more people are living longer. This means that more complex diseases are emerging, and this requires some changes in the healthcare system. Why? Because these complex diseases require ongoing medical attention, so they last for more than 1 year, and of course it these kind of diseases create important challenges for the patient. So in this context, digital platforms are appearing, and yeah, maybe you wonder, that's the question that I heard over, like, I would say that from the very beginning of my career that I started with platforms. But Javi, what's the meaning of platforms? Well, there are many different definitions of platforms. So I totally understand that you heard the term platform, but for this project and the session today, the idea or the main definition of platform is related to those digital technologies facilitating interactions between different actors. So that's the basic idea that we are using. As I said, there are many different definitions of platforms. So basically we focus on, in healthcare, we focus on these digital platforms, these technologies connecting medical professionals, patients, and administrative staff. So compared to analog alternatives, digital platforms reduce transaction costs. Interactions are not as costly in many cases as the analog alternatives. And of course, digital platforms enhance customization. So the patients can have a more active role in the value creation or in the business model. So this is the next part that I would like to explain, which is a critical component or a critical idea in our project. What are the components of the health platform business model? So we use these three terms: value creation, value delivery, and value capture. In value creation, we analyze what need is satisfied through the health platform business model. In this regard, we saw that booking appointments, searching information, tracking indicators are just some ways of providing value creation in a different way through these health platform business models. Value delivery refers to how is the need satisfied. Websites, mobile, tablets, apps are becoming very, very common. And finally, value capture, which is a very sensitive topic that Anna will elaborate later, but I don't want to make spoilers. But the main question is, who pays? How much is paid for those services? I know that this is a tricky question, so again, we will try to answer it. And now Johan will elaborate healthcare platforms in practice.
Well, thank you, Xavi, for that. As we saw on the poll that Anna launched, about half of you would have personal hands-on experience with these actors. And I think the so-called net doctors, they might be the most well-known example of digital platforms. Kry, Doctor 24, Min Doctor would be just some of the examples. These actors, I should say, entered the Swedish primary care market about 10 years ago. And I think they were truly disruptive to the healthcare system. So disruptive meaning that they launched new types of innovation or innovative services that wasn't there before. So suddenly you could have access to healthcare 24/7, and it was like much easier maybe to get in touch with these actors than with the incumbent public healthcare system. So in that sense, they introduced something new. They have also been heavily debated. So some people have felt that they have sort of only catered to people with milder ailments. And it had also been made the claim that they have been sort of draining the public healthcare system on important resources. And let me also say that in our research project, we are not really at all taking a stance on like the role of public and private actors and who is actually going to supply these services. But we think it's a little bit unfortunate that too much of the debate has been sort of centering around whether services should be delivered by private or public actors, instead of also talking about like what are the opportunities with these digital platforms, and how can we, like as a society, really utilize the value that they have the potential to create. So that is something we think we need to talk more about. Next slide, please. These staples, and thank you to Myndigheten för vård och omsorgsanalys for letting us use your slide here. This is from a report that you launched only some months ago, I believe. And it basically shows that the digital healthcare is really on the move. So it increases, it has increased dramatically over time. And at the moment, around 20% of visits to a doctor is actually done via digital channels. And I think that as such really underscores that we need to know more about the upsides and also the potential limitations of these kind of services. And by that, I think we're ready to launch the third poll. So given that the digital care is increasing so rapidly, who do you think are the primary users of these kind of services? Is it younger kids and young adults, or is it older people? So we are again close to 50-50, but Xavi, maybe I let you comment on the results.
Thank you, Johan. Yeah, I see that our audience is quite balanced, which is really nice, because I think that the discussion afterwards is going to be really, really interesting. So thank you very much for your responses. And yeah, we can see that half of our audience somehow is saying that is basically young kids and younger adults. And on the other hand, part of the other half of the audience is thinking that maybe older adults are the main audience for these primary care platforms. So I can give you just some numbers. So as Johan was saying earlier, digital services are still not the first option for many people. So you can see in this figure that physical services are still the dominant option. And the distribution by age is basically showing that younger patients are the ones using digital services a bit more. So I can show you in the next graph a bit more complex distribution of the analog and digital services. And maybe the red graph is, or the red line is the one that you have seen more often, showing that especially kids and younger adults are the ones using the most primary care digital platforms. And on the other hand, office hour visits are a bit more evenly distributed, with more elderly people using them. So in this respect, we can see that the current situation is complex, and we can see that different platforms, different services, and different features are used by different age groups. And we will elaborate this use of platforms, these different features later in the different studies that we will explain. But now we will start with the first study that we conducted, and Anna will give you some insights on it. Anna?
Exactly. It's interesting to see, we started with the demographic changes in Sweden. We started with the hype around platforms, that they are considered to potentially reduce transaction costs and potentially improve customization of care. All this hype around digital health platforms. But what happens then when digital health platforms run by private firms try to enter a public and highly regulated sector such as Sweden? I'm sure many of you have seen in media, the entrance of so-called net doctors providing services online have been raising a lot of questions in media, to say the least. So during the last 10 years, there have been a lot of anxieties expressed by different stakeholders in the Swedish healthcare system. Many legitimate questions, of course. We see in our studies that in the media debate, in the major newspapers in Sweden, a lot of different features of the health platforms have been questioned. So their legitimacy has been questioned, and legitimacy can be understood as, are these platforms appropriate? Do we accept them? So although they have been legally entering the market, their existence has still been much debated. And we see when we analyzed articles from 2013 and today, we saw that different aspects of the digital health platforms were questioned. So questions about the value creation, which Javi spoke about earlier. Also, in other articles, the value delivery was rather the focus of the debate. And finally, some questions concerned the value capture dimension of the business model. So how the platforms get paid and how much. And in very condensed format, what we found was that when the platforms entered in 2013-ish, the questions that arose were focusing on the value creation. Are these platforms targeting a need that is even relevant to address? And also questions around the technological feasibility. Is it even possible to deliver care online? Then, as an inflow of patients emerged and an increasing number of patients started to use these online services, other questions arose. Questions around what is the safety related to the way in which care is delivered? Are the behaviors of the personnel on these platforms complying with medical regulations? So a lot about the integrity of the platforms in terms of whether or not they were coherently delivering safe services. And the platforms adjusted their way of operating as a result, formalizing their deliveries, providing data and transparency of their processes to respond to these questions. And although these debates are still not settled, they have a little bit faded into the background because what is primarily debated, according to our data in today and during the last years, is the payment of the services delivered by these platforms. So how much should they be paid? And what are the implications of this allocation of resources to the platforms? What are the implications on the incumbent public healthcare system? And there are also a lot of questions about who benefits at a macro level. Since there are a lot of users and money is flowing into these platforms, what happens to the people that are not using these services? Are they marginalized? So a lot of unsolved and still debated questions that we hope to return to at the end. But at overall level, our study shows that platform entrance and platform strategies in this context is really a matter of adjusting as a platform to the concerns raised by stakeholders in your environment. So what happens to these platforms is not only dependent on what the platform firms want, but a lot dependent on the concerns of stakeholders in the environment. And now that was a brief zoom out and look back into the history of these platforms. But as I said, concerns about the use or non-use among the elderly is one major concern. Johan, we have also studied how these platforms are actually used by the elderly. So take it away.
Thanks, Anna. So that first paper, academic study that is also published, and we're happy to send you the PDF. That is more about like the entry of into the Swedish market of the different digital healthcare platforms, and we try to then understand them very broadly, like their business models, as Anna pointed out, and how that unfolded over time. And after we sort of got a grasp of that, we started to dig into the situation of the elderly people, potential users and also non-users, and try to understand and disentangle a little bit about why are these platforms adopted, and what are the barriers in particular for elderly people in using them. So our second study was about barriers to adoption and usage. And just so that you know, like in terms of platform theory, adoption is 0 or 1. So either you adopt something or you don't. So like when you download the Kry app, for example, and you create an account, then you have adopted it. And then usage is about frequency. So that is like basically the subsequent number of visits that you do when you utilize the app. And then we started to do interviews with the elderly people, both users and non-users, and it was quite clear that negative attitudes and also anxiety with technology, those were the two major initial barriers that sort of prohibited people from actually initially adopting these kind of platforms. Whereas a lack of trust could block both adoption and subsequent usage. And we think that the net doctors, and let me say not only the private ones, but definitely also the public ones, because in recent years we've been seeing a lot of collaboration in launching these kind of services where the incumbent public healthcare system launches similar services, often based on the digital platform technologies of the private companies. I think both the private and public actors, they can improve a lot in making it easier for the elderly to access healthcare via digital platforms, including working on developing the applications and also marketing and maybe educational activities as well. And we can go into detail maybe a little bit later what exactly that could apply. Next slide, please. We then also moved into trying to analyze the actual usage patterns of the elderly. So like basically, once you are in a digital platform and sort of consume this kind of service, what does your usage pattern actually look like? And here we had the opportunity to work together with a platform company that supplies this kind of platform, and we looked at basically behavioral data on elderly people as they move along the various steps of the platform. And again, I'm not going to go into depth, but it's quite clear that elderly people or patients or care seekers, they take longer time during onboarding. Their cases are typically longer. They wait longer in waiting times. And so on and so forth. And again, I think it's we see quite large rooms for improvement here in making it easier for the elderly to navigate these platforms and actually make sure that the services are adapted to the needs in a better way. Xavi, over to you.
Thank you, Johan. So finally, in this study fourth, we try to complement previous insights. We were talking about primary care digital platforms, those business models. We were talking today also about the barriers to adoption and usage of primary care platforms, this patient journey that the patients are following in primary care, but healthcare is not only about primary care. So in this study, we try to understand a bit better a different type of platform, specialist platforms. These platforms are very important, as I said at the very beginning, because chronic diseases are becoming more and more common. And one way to deal with these chronic diseases is trying to enhance this active role of the user, in this case, the patient. So self-management platform features can help those patients to improve their healthcare. So in this study, we analyze users in a specialist eHealth app, Joint Academy, which is focused on the pain that many patients have in their hips or their knees. Now they are also offering treatments for other parts of the body. And in this study, we focus on trying to understand how different users, based on the cognitive behavior therapy attributes, how those attributes of the users could explain the use of the different platform features. And one of the most important results that we saw connected to the project is that age is positively related to the use of the different app features, app exercises, app lessons, and app messages. So one lesson that we learned from this study is that the very moment that the users start to overcome those barriers and they start to use the platform, those users, those elderly users are using the platform more frequently than younger users. So in this respect, that was one of the most important insights in this paper. This paper is also published, so you can read the details in the link. And finally, maybe Anna can wrap up and just explain the main takeaways from this project.
Thanks a lot, Javi. And it's very easy to wrap up and summarize this situation. No, but first I would like to raise a question from the chat. And someone is, I think it's directed to you, Javi. How does the platform link to the scope that Javi described with elderly people and chronic diseases? So, Matthias, I don't know if you want to clarify the question or elaborate on it, or if you want to add something to your question. No? So Javi, what would you say? Maybe clarify what is the definition of platform in your final study here, and what is the link to the chronic disease, so to speak?
Thank you very much. So the difference between primary care and specialist platforms is that specialist platforms are focused on self-management, in health self-management. So it's very important for these kind of platforms that the users are actually using the platform every day. So changing their behavior through the platform is one of the main goals of these kind of platforms. So the connection of specialist platforms and the use of specialist platforms with chronic diseases is that one of the most efficient and effective ways of addressing chronic diseases is changing some behaviors through this kind of health self-management approach. By changing the habits, by changing the routines that the patients have, they can find some improvements in their life quality and their healthcare. So the main goal of these specialist platforms is providing the users with some kind of treatments that could change their habits and hence improve their healthcare. Did I answer your question, Matthias?
Thank you. Matthias has trouble unmuting himself. Okay, we cannot do that, but please, Matthias, write in the chat if you want to respond to Javi's response in the chat, and I will see it. Exactly, so there are many different definitions of what is a specialist health platform, but I guess the basic difference between a primary care platform and a specialist platform is that the specialist platform is much more narrow and addresses a special, a special medical condition, rather than being open to any kind of condition in primary care as well. But thanks a lot, and very important question. So we will keep track of. Okay, Matthias clarifies here. Do people with chronic diseases use Kry, etc., these primary care platforms? So So then that's a question about the medical conditions of the people in our other studies that actually use the primary health care platforms. Maybe Johan, you would like to address that question.
So I think the best answer to that question would most likely be from somebody from Kry or Dr. 24, for example. But that is not really something we looked into, like when we looked at the process data. But I guess those primary care platforms are open to everybody. So I think the question is a little bit more complicated. It might also be so that patients with chronic diseases use those platforms for other ailments too, right? So, you know, exactly what type of role they fill for chronic diseases, I can't really answer that. So this was never part of our study.
And I think that, and you can we can post a link to our study where we do have some data about the age characteristics of the users that are included in the study. But when you enter a primary health platform, you're not always obliged to tell that platform what about all your chronic problems, right? So the question is how much of those problems are known by the platforms as well, and how much should be known? Should the primary healthcare platforms move into the direction of more specialist care services? And that is, of course, something some of you are in the audience that you are discussing a lot, and that the current regulations and demand patterns shape whether or not the primary healthcare platforms move in that direction and also cater to chronic specialist conditions, rather than only addressing, you know, the first stop problems that we typically associate with primary care. But it's a very important question. Maybe one more question, and then we let our other guests in. A question from Heidi. How do you identify net doctors you referred to before? Yes, a very good question. So digital health platforms encompass a range of different business models, I would say. Some of the digital health platforms are only providing the technology, and then they let the care providers use that technology to provide the services to the end consumer. And other platforms, what is typically referred to as net doctors in the media, these are firms that use technology that facilitate interactions between many patients and many care service personnel. And these platforms also employ or contract healthcare professionals. So net doctors are typically understood as organizations that do not only sell technology, but they sell the entire service to regions, for instance, in Sweden. I hope that answered your question. And that is also more, you please have a look at the papers if you want to read more about the limits of our discussions, because that's a very important question. And by that, I would like to actually call in we have two external guests in this webinar. I'm very happy to have you here. And maybe the first one I should introduce is Gustav Rålenius, currently at the eHealth agency, and you were previously at the Inspectorate for Healthcare Services. Yeah. And Gustav, I know that you are right now struggling with how to define digital health platforms in a meaningful way, because you are investigating this phenomena, so to speak. Please comment on how we should define them, or what you find struggling in defining them, and what you are doing in this area right now.
Yes, thank you. So maybe I can say something about what we're doing right now first.
Yes.
So this is a project that we are working on, and we are like in the middle of it right now. So And the project is on health portals and healthcare platforms. And as you know, there is a lot of different digital healthcare services provided by both private actors, as we're talking about, net doctors, as well as public actors. And in this project, we also look at the services offered by municipalities, like primarily within social care. But we know that they haven't come as far as within healthcare when it comes to digital services. And we're looking at the use of different terms because there is a lot of conceptual confusion, and we're working together with a terminologist on this. And for instance, if you Google the Swedish word for health portals, hälsoportaler, you will get like search result of health promoting services for companies, företagshälsovård. So there's a lot of confusion on that. But what we think right now, our hypothesis is that health portal is a digital portal that facilitates users access to general health care information, and via login provides access to individual specific health and care information, as well as health and care services. So that is like the definition we're working on. And then we have the health platform, and that's the underlying technical solution for health portals and other digital inputs to healthcare information and healthcare services. So this is like what we're working on, but we also, our aim is also to get more knowledge about the users and the different needs of the users, as we were talking about here, and how these services are designed and the content of them. So that's pretty much our project. So it's very interesting to hear about what you're doing. And of course, I'm very interested in the terms that you're using. We're talking about specialist platform, primary care platforms. So I'm really looking forward to knowing more about this.
Thank you, Gustav. And why are you engaging in this topic from the eHealth agency's perspective?
Yeah, because there is a lot of, as I was saying, like confusion on the terms, and we also want to know more about the users of these services and the needs of the services. And I think it's also because we're talking a lot about healthcare right now, but we also want to know about the social care services, the municipality services.
And you want to know about the use of these services so that you can adjust your practices accordingly, or how do you view your role in relation to these conflicts and debates about platforms in healthcare and you know the potential underuse by elderly, or is that a problem? It depends on perspective. What do you say about those thorny and difficult questions?
Yeah, because right now we're more getting like a general, like getting a big picture. I don't see like, so we just want like to gather more knowledge about this and see the different users needs, and especially I think the concept is very important to get like, yeah. So, but I don't think we have really a role within this debate. It's more of getting more knowledge about it, because there are like some gaps within it as I see it.
Yes, I thank you very much, and we look forward to learning more about what you do and what knowledge you produce in your efforts now. I agree that the terminology is important, and we tried in this webinar to keep it simple, but we would be happy to complicate things and talk about the nuances of platforms, and Javi, you would be great in doing that. But maybe I should just check if we have other questions tied to the eHealth agency. Not right now. Thank you, Gustav. I would also I think this shows that we're all struggling to understand this relatively new phenomena and how to categorize the different actors and the different technologies that are emerging, and that how we categorize them has implications on how we should potentially regulate them, or should potentially encourage certain aspects of their practices, or should disencourage other aspects of these new technologies as, you know, agencies or as academics or as users. Åsa, you have been part of a report written by the eHealth, the Agency for Healthcare Analysis. And I know you have been struggling, or you really explicate the struggles in actually evaluating the impact of digital health services on the public healthcare system, etc. So maybe you can start by just telling us about, you know, your conclusions in your report, and then commenting maybe on the discussion so far in the webinar.
Yeah,
Åsa Ljungvall, go ahead.
Sure.
Thank you.
Thanks for having me here today. It's very interesting to listen to this seminar. So first, maybe I should just say a sentence or so about the agency that I work for. So we are an agency, for those of you who are not familiar with us from before. I think that there are people out there who are not. We are a quite small agency that started in 2011. And we are tasked by the government to analyze how healthcare services work. We are also tasked to review how effective government commitments and activities are in healthcare and social care, and also actually dental care. So basically what we do is that we provide information and knowledge to policymakers and decision makers, and give them input about how making their work and operations and the governance of healthcare more effective and more effective and better. And we always take the perspective from the patients and inhabitants in Sweden. So with this background, of course, we also follow and work on the area of telehealth, as I would call it, or digital visits, or net doctors, or national caregivers, or whatever we now should call it, because this is, as we have heard here, and as everybody knows, this is a big policy debate. What role should they have in the public policy system? So in February this year, we published this report with full focus on the so-called net doctors, or national digital caregivers. So we have not specifically worked with the terms used, the definition and so, but more on the issue about actually the users, who use them, what role do they play, who pays for them, how much do they cost compared to physical care, and so on. And based on that, I would say that there are basically two main policy perspectives at the moment related to this work. And the first one relates exactly to what has been discussed here, and that's about the users, who use them. And as we saw, it's mainly the young people. We saw also in our analysis that people with no chronic diseases, or maybe one chronic disease, use them less often than people without chronic diseases. So this is important, because if we look at the physical visits, the pattern is totally reverse. People with chronic diseases use healthcare much more than other people, naturally. But for digital care, we see the reverse pattern. And the same thing with age. Older people use healthcare more than younger people, but for digital care, we see the reverse. The same thing for education. In general, people with lower education use healthcare more than people with high education, but for digital care, we see the reverse. So this is one of the policy concerns, that we see that digital care is used very differently from healthcare in general. So this is, a key issue that we need to consider in the healthcare system, because we need to use our tax money and the social resources according to need. So this means that we also need to make sure that people with higher need, they have to get access to the care that they need. At the same time, I have to say that I very much agree. I think it was Johan who mentioned that, a very important question is how to make sure or how to make use of the digital care and all the opportunities that comes with this development, to make the best use of them for the healthcare system as a whole. How to make sure that we can distribute our resources so it is according to need, but also use the upsides of digital care. And one thing that we noticed also, and I think this is important to mention, is that up to date, there is a quite big research gap when it comes to the medical results and so what's the contribution of digital care? How much does health actually improve, and does the content compare to the physical care? So we know that we spend money on them, but we actually don't quite know what the results are in terms of health. And finally, of course, the second big policy issue here is how should we reimburse digital care? I'm quite sure that you all have heard about this, and the main thing here, policy-wise, in the debate right now, is how to make this digital care be more integrated with the traditional healthcare. Up to now, things change very quickly in this area, but from the beginning, and I would still say to a large extent, net doctors and digital care have developed, so to speak, outside the traditional healthcare system. So they are working, beside healthcare system. They are not at all integrated, and information between the two kinds of system do not flow almost at all. So that is also, and that is related to the reimbursement system and how we pay, or regions pay for the digital care. And that is something that policy-wise they try to solve this issue and consider how to make it more integrated. So that is, that is my view and my perspective on this issue, which is, partly different from the definition and platform perspective.
Thank you, Åsa. Very, very valuable. And in your report, you also conclude that, you are trying to reason about what can we say about the consequences of net doctors? And with net doctors, you mean, well, maybe you should talk yourself. How do you define the net doctors, even if you are not trying to solve the definition issue, but...
Yeah, we didn't spend, a lot of time on the exact definition, but what we mean here are these companies and caregivers who work nationally. So that's why we call them national caregivers. So they basically have connection with one single region in Sweden. And then patients from the whole country can use the digital service without being in contact with their own region. So that is basically the kind of caregivers that we focused on in this report. But again, a lot is going on here, and it happens very quickly. So now much more digital care is provided also within regions, both by private and public caregivers.
Exactly. Thank you, Åsa. And I refer our audience to your report to read your interesting analysis of to what extent can we talk about the consequences of these net doctors on the public healthcare system, and what questions should we continue to ask? I wanted to. I see some questions in the chat regarding definitions, and maybe we should just devote a few minutes on that. We've struggled as well with how to define digital health platforms, so I can start, and then Javi, Johan, you fill in. Regarding the first study, we departed from the platform definitions as multi-sided markets initially. You know, a platform is a provider that allows direct interactions between many consumers and many service providers. So from that perspective, you know, platforms are typically viewed as just the matchmaker that does not employ personnel. The platform does just, you know, allow a lot of Uber drivers or home owners to offer their services through a platform, and then the platform just facilitates interactions with many consumers on the market. The net doctors they don't completely fulfill that definition of a, you know, multi-sided markets, because as we saw, the net doctors are sort of a hybrid or semi-platforms, because they do often employ personnel, but they also sometimes contract personnel. So on the supply side of the platforms, there are different relationships between the net doctors as platforms and the service providers whose services they mediate. But of course, they do match multiple consumers or multiple citizens with the providers that they have in their that they have some sort of contract with. So that's we also see in relation to the digital platform discussions in the literature that these kinds of, you know, versions of platforms, they also require us in the academic literature to adjust our definitions a little bit and think about the range of different business models that arise in platform contexts. But Javi, maybe you want to add to this.
Yeah, thank you, Anna. Yeah, I would just say that in platform literature, we found that platform business models are dynamic. So trying to find like a static definition of platform is very difficult, especially in this rapidly changing environment. So in this regard, even these typical matchmakers like Uber or Airbnb, they have changed a lot over the years. So I was watching last weekend this playlist show on Netflix about Spotify, and maybe if you saw it or you heard about it, their business model has evolved a lot over the year. So in this respect, something that we chose or a decision that we made in order to use the notion and the term of platform is assuming that this context is a very emerging state. So it's at the very beginning. So it's very, very difficult to find very rigid terms in this context, because by definition, they are supposed to be changing. And this is one of the main conclusions that we found in the first paper that Anna was explaining, that the platform business model is being designed and redesigned based on the legitimacy debates. So yeah, eventually maybe we will see, or I would expect even more changes, and we'll see if still the definition of platform is fitting, or on contrary, is totally exploited, and we'll see maybe network effects more clearly. We'll see. But right now, I would say that if you have problems to fit the traditional definitions of platforms in this context, the reason that we found is that maybe it's because they are a very, very early stage.
Thank you, Javi. Johan, did you want to add something?
No, I'm good. I think we can use the last few minutes to other questions from the audience.
Yes. And we have a comment about the chronic diseases on primary healthcare platforms. And of course, many patients with chronic diseases are using the services on the digital health platforms. But according to our data, some platform firms perceive that there are many constraints impeding them to move more in the direction of chronic disease services and serving more specialist related services. So although, of course, as a primary care provider, as an online primary care provider, you do address people with chronic diseases and you talk about issues related to chronic diseases and you refer patients to specialist care, we see that the platforms have deliberately avoided to add features and, monitoring devices in their homes that could potentially even extend the offer to specialists or to extend the offer to patients with chronic diseases, and they are avoiding to add those kinds of services because there are many uncertainties regarding payment and their role as online care providers. And as Åsa said as well, now of course many net doctors are also establishing physical care centers, and that also contributes to the convergence and the blurry boundaries between net doctors and regions or public actors that are also providing online care services as well as physical care services. So a lot of changes occurring all the time, which makes it perhaps even more important to follow and monitor and see who is affected how. Let's see what questions we have. We have maybe a final question, and then we will stay a few minutes for other questions in the chat. But for those who have to leave, we have a question for you, Åsa. Have you been working on identifying some KPIs on measuring the impact of digital solutions on reducing healthcare costs? Or are you looking for different ways to measure their impact? So,
Yes. So one thing that we did so far, I should say that what we did in this analysis is based on data up to 2018. So this is one of the challenges when you do, this kind of more complicated, in-depth research, that it takes so much time to get data from the regions. So this, it's not fully updated, but what we saw so what we did was that we analyzed whether the digital visits substituted a physical visits or not, or to what extent. And what we found, there are many methodological challenges here, but what we can say, the conclusion from this was that yes, to some extent they can substitute and help traditional healthcare or physical healthcare, but overall it also added on a lot of visits. So in total, the costs were increasing, and the scope or the number of visits increased a lot. So so therefore it's difficult to say that so far they have saved money for healthcare. But on the other hand, again, coming back to that, more visits is not necessarily something bad. It may be something good, but then we also need to know the upside of it. What did it actually give us? And there, it's more difficult to say, since we also see in data that there are, in general, more low need people or patients that use this kind of visits. So I don't know if that is a full answer to the question, but at least it's some reasoning about it. And of course, we would like and need to know more about the cost effectiveness of the visits. So if we can get that, it would be great. Yes, at the moment, we don't have any specific work on this.
Åsa, I think you write nicely in your report that you could say that the productivity of meetings have increased because you can run a larger number of meetings per cost unit, but the effectiveness is to be debated and partly a political question. And I would also like to add that, yes, we tend to understand digital health platforms as addressing lightweight needs. On the other hand, we see in our research that these firms are also a little bit constrained in how much they can address the more complex needs. So we're all responsible for, in a way, the way in which certain needs are addressed rather than others. And hopefully our studies can provide some input to the potential changes that could at least, accommodate for a larger number of needs among citizens. But it's a huge question. Thank you so much for your comments, Gustav and Åsa. Gustav, obviously, we're very interested to hear how you develop knowledge about this topic. A few takeaways in brief from our research and this seminar is that, obviously digital health platforms in many variants of them are gaining market shares and are spreading in the Swedish healthcare system. And many stakeholders are to blame, sort of, for what they have become. And that's why it's very important for us to, from many perspectives, discuss how we shape their evolution onwards. Their role in the healthcare ecosystem is still very debated. And it's a very heated debate we see in our interviews. A lot of emotional anxiety tied to these platforms. Elderly individuals are underrepresented in many of these platforms, but not all, as Javier showed. Is that a problem? Or whose problem is that, if so? There seems, in any case, to be improvement possibilities regarding the interface, but I think, it's an important question onwards to think about. What role do we want these platforms to play? That's what I had to say. Johan and Javi, would you like to add something?
No, Anna, I think that was a great summary. Thank you.
Great. Thank you. And by that, I think many of you may need to go back to work, but we will stay for a few minutes to discuss more. And maybe there are questions in the chat that I haven't seen yet, so I will take a look at that. But thank you, Åsa Ljungvall and Gustav Rålenius for sharing your insights. Very important.
Thank you.
And to everybody else that attended.
Yes, of course. Thanks a lot. Thanks a lot. And thank you for your questions. So by that, I will take a look at the chat. I think someone asked if what impediments. I think that was tied to the movement towards chronic care. Matthias, could you clarify in the chat what your question concerned? Maybe it was a while ago. While you do that, can you suggest some sources of official business models that might utilize monetization of data? Could the net doctors be considered such a model? In this last case, who is responsible for the patient's data protection? Yes, what a great question and important. And maybe I should let, I've been talking so much. Javi or Johan, would you like to start? Javi, you've been thinking about this data monetization issue, I know. Maybe you would like to start. Regarding the monetization of data, could the net doctors be considered a model for how to monetize data? That's one part of this question.
Thank you very much. Well, I would use the similar idea that I was saying before, that they are a very early stage, and profitability of business models platform business models is still under scrutiny. And even very successful business models are still having some issues in finding monetization or how to exploit data. For example, Babylon in the UK, they started their business model for healthcare with the idea of almost replacing doctors or some kind of doctor-based services based on artificial intelligence. Over the years, they are having some problems because still doctors are having some skills and some capabilities that data is not able to replace yet or so far. So in this respect, I would like to give you an answer about the future, but I don't know. And about the present, I would say that it looks more like a goal than an actual solid strategic decision, how to exploit data. So we'll see in the future, and that's my opinion based on current information that we have. Data is more like a promising path than an actual key resource. So.
Thank you, Javi. And I think it depends on how you view the monetization of data in these platforms. Of course, the platforms they exploit the data they have, and there are huge amounts of data about patient trajectories that is used internally. But as you said, Javi, if we think about monetization as a platform strategy used in other sectors, that you can, accumulate a lot of data about transactions that you can later sell, or that you can accumulate transaction and behavioral data about users in many different settings and maybe even across countries. That's where we see that there are many regulatory hurdles for the platforms, obviously, and also legitimacy concerns. How are you using my data? That's very important for the users to feel safe about in this context. Johan, would you like to add to that?
No, I think I'm pretty good. There's this joke in our research project that Xavi is called the platform guy. So I think he's much better than me on this topic, and I think his answer was also exhaustive.
Yes. Let's see. And thank you for staying. It's very nice. A question to Åsa. I think we covered that.
Anna, maybe I can just make a broader reflection while you're looking at the chat.
Yes.
So like one hallmark of platforms is the idea of network effects. And network effects can be cross-sided or same-sided. So like in a healthcare platform, it can be, patients talking to other patients or helping each other, or medical professions like doctors and nurses talking to each other and, helping each other, exchanging information and knowledge. And the platform taking the role of mediating those exchanges and amplifying them and making them better. And I think, at least in my opinion, this is a major difference between healthcare platforms and let's call it like conventional platforms in markets that are not regulated, because there are so many caps on these network effects in the healthcare sector, like, legal-wise institutions, conventions, norms, that I think make sometimes the healthcare apps or healthcare platforms a little bit challenging to compare to regular platforms. So yeah, that's just an observation.
Yes, thank you. Very good one. And maybe that's also why we see a range of different strategies being deployed by the healthcare platforms. Some moving into the direction of licensing their technology rather than providing services, and some are expanding the range of services they are providing, and some may be narrowing their services as well. So we have a final question I think we can take before we wrap up, and that is if there has been any study on secondary health data and how they can complement the primary data, health data collected by the healthcare platform. And I think this is a very important question. We have not focused on that in our project, but obviously, I mean, there are many research projects combining data from digital health platforms with other registry data or data from patients' monitoring of their health in their homes. So a lot of research projects trying to use secondary data in a sense to publish papers. But if you are referring to the use of this data in real time in routine care, I think the interfaces between these different information containers, so to speak, in healthcare those interfaces are still challenging. Of course, we have 1177, the National Health Platform, trying to create interfaces between different systems in healthcare, but a lot of struggles going on, but also a lot of efforts, I would say, in general. Please, if anyone in the audience has more specific ideas here, please chip in, or the other ones. Yes, so I think it's time to wrap up. If you have more questions, please email us, stay in touch, and it would be nice to hear you as well. So we would be open for a chat in any way that is more interactive. Thank you so much for joining today, and the papers are available online. A very exciting topic, and we will continue to following the NetDoctor's evolution in Sweden from now on as well. Have a very nice day, and thank you once again, Johan and Javi, for joining.